Assalamu alaikum and welcome to the fifth match of Cardiometabolic Premier League, the Battle of Brains, presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the fifth match, which is between Lumhs Strikers and Mayo Knights. Ames Invincible from Group A has already been qualified for Super 6 stage. This match is again a crucial match because every match is a knockout match. Today, we are blessed with the kind presence of Professor Tariq Wasim Saab. He is Professor of Medicine and Head of Department of Medicine, Salim Memorial Hospital, Lahore. And for moderation purpose, we have with us Assistant Professor Dr. 𝐏𝐻𝐬𝐿 Saab. He is Consultant Interventional Cardiologist and Stroke Interventionist at RIC, Rawalpindi. For further moderation, over to Hamza Saab.
Thank you very much, Usman. So I welcome you all today to this first season of an exciting cardiometabolic Premier League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Hypertension League and Pakistan Society of Internal Medicine. So I've come back after a gap and I'm extremely excited to be back today in this wonderful show. In my absence though, Dr. Qurban, my friend, he did it wonderfully well and we had some very interesting matches. So we begin this new year with a lot of aspirations, a lot of work, and I think there's a lot of work and a lot of fights to be seen in this league. And today we have the two teams which are going to be up against each other. We have Lumhs Strikers from Hyderabad against Mayo Knights from Lahore. So it's the clash between the two provinces, Punjab up against Sindh. And we are all hoping for a wonderful game. I'm also excited and I would like to take the opportunity to welcome our panel of experts, our faculty members. And as we know, we have our Patron-in-Chief, Professor Mohammad Ishaq Saab. Welcome, sir. Great to have you. And I'm excited.
Assalamu alaikum. I am connected from my village, Noshera. You see, I'm here in connection of a jailum of my nephew's death, you see, last month.
Sir, heartfelt condolences, sir, from our side.
But I am here. I'm connected with you.
Sir, it's great commitment from your end. Lots of prayers for you and your family. It's great to have you. And we also have a list of panel members. I think we'll have the introductions as they join. But last but definitely not the least, it's our umpires who are important for maintaining the order of the game. So we have Professor Tariq Wasim Saab. Sir, welcome on board. Great to have you.
Thank you. Thank you.
Right. So now we have to get to the business end. And when we look at the weather, it's pretty good. I think the sun is shining bright. But when I look at the pitch, it seems to be a bit tricky. So I do expect some turn in the wicket. Let's see how they cope up. With this, I think I'm going to move towards the two teams and randomly I'm going to ask them and the captains to go for the introductions. So I think I'll ask our team, let's see, Lumhs Strikers Hyderabad. Captain to introduce, please.
Assalamu alaikum. My name is Dr. Syed Bilal Kazmi. I'm from Cardiology Department, Lumhs, Hyderabad. And we have your name, Dr. Gulzar, Dr. Punam, Dr. Momin, and Dr. Asma.
Okay, so it's great to have you. I see you all geared up for the game today and best of luck. So I now move to Lahore, Punjab. So Mayo Knights, can we have them on the screen? Captain to introduce, please.
Assalamu alaikum. I am Dr. Shaza Munir. With me, this is Dr. Tuba, Dr. Jihad, and Dr. Abiha.
All right, so great to have you and best of luck for the game. We are hoping for a very tight match. All right, with this, we now move towards the all-important coin toss. So it is going to be done electronically. So can we have it on the screen? And I'm going to randomly ask one of the teams to call it heads or tails. And I believe it's
Heads.
Mayo Knights. Mayo Knights, can I have them on the screen, please? It's a random selection. Mayo Knights, heads or tails?
Tails. Tails.
Tails it is. Roll it, please. And it's a tails. Oh, you won the toss. So let's see. I think the luck is on your side. Let's see how it goes, but you really have to play well. So I'm now going to pose you with two questions. The first one is, do you want to take the questions or you want to throw the questions?
Take the question.
Okay, so you want to take the questions. Okay, now the second question. So there are two veneers in front of you, two cases, A and B. Which one do you pick?
B.
So they have picked case B. And the news from the center is that they are going to take the questions and they have taken the option B, Mayonites. All right, so they're going to take the questions. I hope the Lumhs strikers are now ready. Are they ready? And
Yes.
we have the first case on your screen. Please start reading the vignette.
A 21-year-old boy presented to you with one-day history of bilateral mild frank pain and blood in urine. Apart from episodic headache for the last 6 months, his past history was insignificant. However, his father died of brain hemorrhage 8 years ago. On examination, he was afebrile with blood pressure of 160 by 90 millimeter of mercury and pulse of 98 beats per minute. CNS, chest and precordial examination was insignificant, but abdominal examination revealed bilateral palpable kidney with no renal buoy and renal punch was negative. There was no periorbital or limb edema. Lab finding revealed a hemoglobin of 13 gram per deciliter, TLC 5600 per centimeter, and urea 42 milligram per deciliter. Creatinine 1.5 milligram per deciliter, eGFR 82 milliliter per minute. Serum electrolytes were normal. Urine showed 3 plus blood, but no cast crystal, glucose or protein was seen.
Okay, so Mayonites, you can take a few seconds to gather yourselves and let us know when you're ready.
We are ready.
All right, they are ready. Can we have the first question on the screen, please? Read the question, please. Strikers?
Option C, polycystic kidney disease.
Okay, I would request the teams to please... Strikers, are you there? Can you read the question?
What is your diagnosis? Renal artery stenosis, Cohen's syndrome, polycystic kidney disease, Miller-Mehl chain disease, or renal calculi?
Okay, and the timer starts now, 60 seconds.
Option C, polycystic kidney disease.
Okay, so they've come down the wicket. They were even trying to answer it before the ball was delivered. I could see that. You have to wait for them. So are you ready for it? Ishaq Saab won't be happy because he wants you to take your time. You still want me to lock it? C, polycystic kidney disease?
Yes.
Okay, they are very sure. They've come down the wicket. Lock C, polycystic kidney disease. Is it going for a 6? Let's see. Lock it, please. And yes! Well, it was far away into the stands for a 6. Very well done. That's a wonderful start. And I could see the confidence in you. So very well played, very well done. But still, you have to wait for the question, take your time, and then answer collectively after having gone through it. This is definitely going to help you in the subsequent questions. All right. We are now moving towards question number 2 on your screen.
What is the most initial screening test would you like to order to reach the diagnosis? Ultrasound abdomen, renal angiography, 24-hour urine for protein, plasma aldosterone for to renal ratio, CT KUB.
All right, timer starts now, 60 seconds.
Option A, ultrasound abdomen.
Oh my God, they've come down the wicket again. I see a bit of Jaisuriya in you and you want to heave it for a 6. All right, this time it's long off. So, which one? Which one should I lock?
Ultrasound abdomen, option A.
Okay, you're sure about it?
Yes.
Okay, Ishaq Saab is on the edge of his seats. Lock A alpha, ultrasound abdomen. And yes! Very well played. And that's a beautiful stroke, I think. Wonderfully played. Jayasuriya is on fire, I can say. Well done. Okay. 2 deliveries, 2 questions, and 2 sixes. Can we have a hat trick? Moving to question number 3 on your screen.
What is the minimal ultrasound criteria in his age group to confirm the diagnosis? 1 unilateral renal cyst, 2 unilateral renal cyst, 3 unilateral renal cyst, 4 unilateral renal cyst, or 5 unilateral renal cyst.
60 seconds on your screen.
Option B, 2 unilateral renal cyst.
Oh my goodness, this has been swept, I think. Okay, are you sure you want me to lock?
Yes.
Which option? Which option should I
B.
lock? B.
Option B.
Okay, B beta. So they want me to lock B beta, option B, right. So they've tried to hit it again over short third man, over the third man for a 6. It's up in the air. Let's see where it ends. Lock B beta. Oh no! It got the top edge. And this has been caught. All right, all right. So again, I think you all have to talk about it, discuss it. You've got 60 seconds at your disposal. Make the most of them. Okay, so that's the first miss. Never mind, we still have 7 more questions. Moving to the next one. Question number 4. Read the question, please.
Considering the cause of his father's death, what else would you like to order? MRI brain, MRA brain, MRV brain, CT brain, X-ray skull.
All right, timers is on your screen now.
Option B, MRA brain.
Oh goodness, are you sure? Option B,
Ji.
MRA brain. Okay, they want us to lock option B beta, MRA brain. And this one, for this, they've come down the wicket and they've taken it on a full toss. Oh, it seems as if it's a T5 going on. Okay, lock B beta, option B. And yes, this is very well played. I think they were confident about it and I could see that. And that's a huge 6. It's a straight drive for a 6. Very well done. Well played. So that's 3 sixes now in 4 questions. Well done. Okay, we are now moving towards question number 5. We all thought it's going to be a turning wicket, but then they are taking everything by coming down the wicket and they're heaving it for boundaries. Good start. Question number 5 on your screen.
What is the first line treatment to control his BP? Alpha blocker, beta blocker, calcium channel blocker, diuretics, AC inhibitor.
60 seconds on your screen. So this one has pitched.
Option E, ACE inhibitor.
Okay, and it's moved. It can go either ways. Which one? Option?
Option E.
Option E, epsilon. All right, you want me to lock it?
Yes.
Are you very sure about it?
Yes.
Okay, they're sure. Let's lock option E, epsilon. ACE inhibitors. Lock it. And yes, yes, and yes, they are sure about it. Very well played. Well done. So I think, yes, the ball is turning your way and it's hitting your bat in the middle. Very well done. Moving to question number 6.
What are your BP target in this scenario to improve his cardiovascular risk? Less than 140 by 85, less than 130 by 85, less than 120 by 80, less than 110 by 80, less than 110 by 75.
And timer is on. 60 seconds. Is this a bouncer that we were waiting for? Are they going to pull it or hook it or cut it? Let's see. "25 seconds remaining.
Option B, 130/85.
Option D.
B.
B for beta.
Less than
Okay.
130/85.
Yes. Option B, beta. Okay, less than 130/85. Lock option B, beta. Oh, and that is a miss. So clearly you tried to pull it and missed it altogether. Well, that's your second blemish of the innings. Still good going. This gives a lot of hope to Hyderabad. Strikers, I see a glimmer of hope in your eyes. Okay, let's see where it ends. All right, can we have the next question? Question number 7 on your screen, please.
What is with the desired BP control? What specific target are you aiming at to improve his prognosis? Decrease in creatinine, increase in GFR, decrease in aneurysm risk, decrease in LV mass index, decrease in kidney volume.
Timer starts now.
Delta, decrease in left ventricular mass index.
Okay,
Delta
so
D.
you're sure about it? You want me to lock it?
Yes.
No discussion needed? Okay,
It's
as
okay.
sure as they are, it's going to be delta. So lock D delta, please. And yes, that's very well done. And this one has been smashed. Well done. Over square leg for a 6. I think we knew that this was going out of the park. Well done. So with this, you've now reached a score of 30. And we still have 3 more questions to go. So you can put up a very good total. Let's see. Can we have the next question? Question number 8 on the screen, please. Read the question, please. Strikers. Okay, do we have strikers? Can you unmute, please? Strikers, are you there? Okay, so
Our screen is not working.
But can you see the question? No? Okay, so I think there's a technical problem in Hyderabad. We have lost the signal. So I'm just going to read question number 8 myself. He was non-compliant to treatment, and after a few days, he presented to you with high-grade fever and increased white cell count in CBC, complete blood picture. What will be the choice of antibiotic? Your option A, ciprofloxacin. Option B, ceftriaxone. Option C, vancomycin. Option D, amoxicillin. Option E, doxycycline. And your timer starts now. Okay, I would request the answering team, Mayo Knights, to please switch the mic on. We want to hear your discussion.
It's on.
Okay.
It's option A, ciprofloxacin.
Option A. Okay, you want me to lock option A?
Lock.
Okay, so Knights, they want me to lock option A alpha. Lock it, please. Oh, yes. This is very nicely played. I thought the ball was turning the other way, but you got it well. And it's a beautiful 6. Well done. Very well played. Score of 36. Good. And while I'm saying that, I think we have our strikers from Hyderabad. They are back live. So can you hear me?
Yes.
Okay, so they have answered question number 8 correctly. They are now standing at 36. 2 more questions to go. And we are now moving to question number 9. Read it, please.
Few months later, he presented to you with atypical chest pain, palpitations, shortness of breath, and cardiac murmur. What will be the most probable cause? Rheumatic heart disease, autoimmune disease, infective endocarditis, mitral valve prolapse, or uremic pericarditis?
And the timer starts now. Okay, so is this a full toss? Is this going for a 6? Let's see. As a cardiologist, I am excited to know the answer. Mayo Knights, we can't hear you. Is the mic still on?
Option D, delta, mitral valve prolapse.
Option D, delta, mitral valve prolapse. Okay, are you sure you want me to lock it?
Yes, lock it.
Okay, lock D, delta. Oh, that was a tricky one, but very well played. Very well done. This was smart thinking. Okay, so, well, 42. That's a pretty good score. And we still have one more question to go. All right, moving to the last question of this innings. Can we have it on the screen? Strikers, please, go ahead.
Due to his non-compliance, his condition progressed to CKD. All of the following CKD complications are expected in this disease except very low HB, proteinuria, EGFR decline, increase in creatinine, and fifth, hyperkalemia.
Timer starts now, 60 seconds.
Option A, very low HB.
Okay, are you sure?
Yes.
It's a paddle sweep, and I think, is this going for a 6? The fielder is waiting on the boundary. Let's see whether it's a 6 or a catch. Which one should I lock? Say it again, please.
Option A.
Okay,
Low HB.
lock A alpha. Very low HB. Lock it. And yes, you've done it. It's over the boundary, over the rope for a 6. And that's well done. Very well played. Very well played. And with this, we now come to the end of this first innings. And the news is, Mayo Knights have put up a very good total. It's a score of 48. That means out of 10, 8 questions were answered correctly. And it's a very competitive score, something to fight for. And I think Lumhs strikers will have to come out all guns blazing. Let's see whether they bring their 𝐩𝐫𝐞𝐬𝐿 out today. Okay, so with this, I now move towards the panel of experts. We have our highly esteemed Professor 𝐸𝐵𝐸 Sahab. He's always there with us. It's always so good to have him, and he's been the mainstay in all these leagues. 𝐸𝐸𝐸 Sahab, can you hear me? So I believe 𝐸𝐸𝐸 Sahab is not there, but we have our umpire, and I think he's extremely important for this game. He's been visualizing everything, every moment of this innings. Sir, Professor Tariq Wasim Sahab, your input, please, sir.
Right. So,
And
I think as an umpire, I have to be neutral. I wish that the other team performs as good. So, as far as the Mayo Knights are concerned, being my parent institutes and that, I am glad that they performed very well.
Thank you, sir.
thank you very much. I think that's going to give a lot of support to your team, and I think to the other teams also. It's a very healthy competition for everyone. We all come here, we all sit, and we all take so much home. It's a learning process for everyone. So, and I believe since we don't have the rest of the panel with us at the moment, I think we're going to move on to the second innings. Okay. Sir, do we have the permission to start the second innings?
Yes, I mean, ask the competitors, the Lumhs, that whether they are ready.
Okay. I think
Yes, we are ready.
We will give
you
both
want
the
to have
teams.
a pitch rolled for a heavy roller or a light roller?
Okay, so as I think they would want us to roll it lightly, because I think the pitch seems to be working fine. It's just that they have to play it sensibly. And best of luck to both the teams again. And we are going to start the second innings. Can we have the case A on the screen, please? All right. So Mayo Knights, read the question, please, and the scenario in.
A 16-year-old male, known case of beta thalassemia major, now presented to you with increasing shortness of breath, palpitation, abdominal pain, and flare pain
Hamza,
in both knees.
please, I
On
lost the screen. I
examination,
can't see.
Okay, just hold on. I think 𝐸𝐸𝐸 Sahab is trying to say
Screen.
something.
Can you please
Yes, sir. 𝐸𝐸𝐸 Sahab.
ask the IT to
𝐸𝐸𝐸 Sahab, can you hear me?
look into that?
Oh, okay, so we can hear you. Can you hear me, Ishaq Saab?
I can hear you, but I can't see the picture.
Okay, so technical team, please look into it.
I'm
I
in
think
a
Ishaq
remote,
Saab.
not very remote place, but reception to theek hai. But
Sir,
I can't see, I lost the picture.
I think, sir, you must be having some technical internet issues, and I think our
Sir,
team is on it.
actually, we can't see the question too. We can't see the question.
Okay, you
So
can't
there's
see the
a problem
question?
there.
Yes, sir.
Okay, so I think I'm just going to move towards the questions. So, strikers, I'm going to ask you in a moment whether you can see it or not. So, can we have the question and the vignette on the screen, please? Can you see it now?
Yes.
You have okay. So they have it on the screen, and I'm going to request Mayo Knights to please read the vignette from the start.
A 16-year-old male, known case of beta thalassemia major, now presented to you with increasing shortness of breath, palpitation, abdominal pain, and severe pain in both knees. On examination, he was a thin, lean boy of dark complexion with a pulse rate of 120 regular. BP was 90/60. JVP was raised. Saturation 94% at room air. BSR 253. He was conscious but agitated. Chest examination revealed basal inspiratory crackles, loud third heart sound on precordial auscultation. Abdominal examination revealed a palpable lever of 4 cm below right costal margin. Lab report revealed HB9, low MCV and MCH. WBC count 7400 and platelet 2,40,000. ALT to AST ratio was slightly high, but clotting profile was normal. ABGs, RFTs, and serum electrolyte were normal. Chest X-ray revealed cardiomegaly and bilateral fluffy shadows. ECG showing normal sinus rhythm. Echo shows ejection fraction of 35%.
Strikers, you can take a few seconds to collect yourself and let us know when you're ready. Okay, and I'll request Ishaq Saab, you'll have to pin yourself, I think. Have you pinned the screen, sir? Please do check it up. And can we have the first question on the screen now? Okay, we have the first question on the screen. Read the question, please.
What is your diagnosis? Question 1, what is your diagnosis?
And all the options also? Read the options also and then answer, please.
Disease. Option A, Wilson's disease. Option B, high output cardiac failure. Option C, diabetic ketoacidosis. D, Budd-Chiari syndrome. E, hemochromatosis.
And your timer starts
Hemochromatosis.
now.
Hemochromatosis.
Hemochromatosis. Option E. Oh, he's come down the wicket. I think I do see a lot of Gilchrist in him. So he's responding to Jai Surya now. All right. So is it a 6? You want me to lock it?
Yes.
Okay, E, hemochromatosis. Lock it, please. And yes, that's the right reply. Great. What a reply. What a response. That's a wonderful response. Great start. Lumhs strikers are onto it. Can we have question number 2 on the screen, please? Read it, please.
Question number 2. What further investigation will you like to order? Serum ketones level, hepatitis profile, iron studies, copper studies, CT, MRI brain, abdomen.
60 seconds on your screen.
Iron studies.
Are you sure about it?
Yes.
Option C, iron studies. So again, he has taken a step down and he's smashing it over long on. Gilchrist, what's up? Let's see. Lock C, Charlie. And it's a 6. 2 on a trot. Well done. Well done. So we are looking for a hat trick now. Question number 3 on your screen.
Question number 3. What is the most initial management in this case? IV diuretics, phlebotomy, insulin infusion, blood transfusion, IV deferoxamine.
60 seconds are on.
A.
Are you sure?
No.
No, sorry.
Wait.
Wait.
Okay, so Ishaq Saab always says, take your time. Don't be hasty. They're not sure. You have to unmute your mic. You have to unmute your mic. We can't hear you. We can't hear you.
Yeah. Sure. We have unmuted the mic.
Okay, so okay, quickly answer.
देखें आप failure में ना patient. Should be
Exactly. A.
Should be A.
A.
Are you sure?
वो है सही.
You want me
Yes.
to lock? A alpha.
Yes.
Okay. So there was some confusion. The ball was ducking in. They were heaving it on the onside. Let's see where it goes. So they want me to lock A alpha. Lock option A alpha. Oh yes! That is a 6. Well done. 3 in a row. 3 sixes, 3 correct answers. Very well done. I think that's very well played. Okay, but I will request the teams to keep your mics. The answering team is supposed to keep the mic unmuted so we can hear the discussion. It's this discussion which actually makes all the difference, and everyone enjoys that. All right, so we are now moving to question number 4.
Question 4. What is the best management to improve the recurrent symptoms after initial management? IV penicillamine, regular insulin, IV drug diuretics, weekly phlebotomy, iron supplements.
Answer, please, and the timer is on the screen.
Phlebotomy है ना. Weekly phlebotomy करेंगे मेरे ख्याल से. Overload में ना. वो iron overload में.
उसमें हम डेफिनेटली आईवी वो देते हैं ना. आयरन चेलेटर्स देंगे. आयरन सप्लीमेंट्स नहीं देंगे. आयरन चेलेटर्स.
आयरन चेलेटर है नहीं. पेनिसिलामाइन विल्सन का है. बाकी बचे डायरेटिक्स नहीं. फ्लेबोटमी सही लग रहा है. देखिए डायरेटिक्स तो दे दिया आपने.
एनीमिक है तो थैलेसेमिक एनीमिक होगा ना.
अरे अब वो थैलेसीमिया चला गया. आपने उसको आयरन कर दे दिया.
25 seconds.
I think
D. Weekly phlebotomy.
You still have 20 seconds. So are you sure?
Yes.
Which one should I lock?
D. Weekly phlebotomy.
D delta, weekly phlebotomy. Okay, lock D delta. Oh, very nicely done. I think this was a wonderful example where you were discussing the question. I think everyone's input was there and we thoroughly enjoyed this answer. Very well played, team. This is the team spirit. So great answer. 4 in a row and the score is 24. So we've reached half the score. Good. Great going. So I think it may just go down to the wire. You never know. All right. Question number 5. Question number 5 is on your screen, please. Read it.
Question 5. What is the most important test to confirm your diagnosis? Serum ferritin, transferrin saturation, CT, MRI abdomen, liver biopsy, skin biopsy.
Timer starts now.
बायोप्सी देखें. ट्रांसफरेंस सैचुरेशन एमआरसीपी लिखती है. स्क्रीनिंग है. ठीक है. फेरेटिन भी यही चीज़ है लेकिन गोल्ड स्टैंडर्ड लिवर बायोप्सी है.
लिवर मतलब लिवर
गोल्ड
सेकेंडरी में नहीं है.
मैडम ये देख लें. ये मेरे ख्याल से तो लिवर है. बाकी ये ट्रांसफर.
और कौन सा ऑप्शन?
We are unable to see the answers.
Okay, I think can you take me back to the screen, please? Yes. So I think the team, you have to discuss it amongst yourselves. Nobody except for the team can give the input. So please, I think these are the rules. Please follow the rules. You have 20 seconds. Quickly answer.
बायोप्सी की नीड नहीं है.
15 seconds. Hurry up.
It's B. Transference saturation.
Okay, B transferrin saturation. You want me to lock it?
Yes.
सही है.
Okay, lock B beta. Oh, that's the incorrect answer. The first miss. Okay, so that's the first miss, and you've missed your 5th question after correctly answering 4 questions. All right, so never mind. There is still chance left. I think you can still go ahead and win the game. I think again I would like to reiterate to both the teams, while you are sitting over there, it is only the team which can discuss, and I hope The on-ground team is also ensuring that, because you cannot have crosstalk and you can't talk to anybody other than amongst yourselves. So I hope in the spirit of the game, we will all make sure that we are doing it as per the rules of the game. All right. So, okay, I think there's a technical issue, so they've told me to hold on for a couple of minutes. And I think, so this gives me an opportunity. I think this is a wonderful opportunity for all of us to learn. And the season is going great. The teams are putting up a wonderful fight. And it's great to see the camaraderie amongst these residents and fellows when they are discussing things and they're coming up with all these answers. And this is part of their learning process. I think a lot of credit goes to the team who comes up with this show. A lot of work goes down when they are making these questions, and these are all indigenous questions which are made by the teams of doctors and reviewed by the panel. And then the coaches and the mentors of the teams, they have a major role to play, and the teams have done wonderfully well. So I'll once again ask the technical team, are we ready? Okay, so it's all about that, and I think this is part of your grooming. Winning is just subjective. I think winning is not always what you need. At times it's the whole process of learning, process of training, which is very important, and we all go through that, and then the end product is something which benefits everyone, the society in general, the patients and healthcare. So with this, I think I've just been told that we are good to go and we are back live and we have the teams ready. Okay, so we have had 5 questions so far, almost midway in the second innings, and they have put up, strikers Hyderabad, they have put up a score of 24 in 5 questions. They've missed 1 question. Never mind. We are now going to move to question number 6, and the total to beat is 48. Can we have question number 6 on the screen?
Question number 6. What is the reason of cardiac involvement in hemochromatosis? Constrictive pericarditis, rheumatic heart disease, infective endocarditis, dilated cardiomyopathy, hypertrophic cardiomyopathy.
And the timer starts now.
दे दूं जवाब यार रुको हाँ डीसी पे इट्स डी डीसीएमपी डायलेटेड कार्डियोमायोपैथी
D, dilated cardiomyopathy. So I think you're going for extra cover, and it seems like you're close to the boundary. You want me to lock it? Option D?
Yes.
Okay, they want me to lock option D. Lock D, please. Okay, so yes, you can't see it on the screen, but it's a technical error, but we've just been told it's the right answer. Yes, it's the right answer. Very well done. And over extra cover for a 6. So this is great going. You are definitely chasing the target, and this target is now within reach. You are in striking distance. So let's see how we end up. And I think again there is a technical glitch on our side, as we've lost the screen. Okay, so who's there with me? Are the teams there? Okay, so I think we have an issue with the screen. We've lost it, so the technical team is on it. So we are waiting for the signal. Okay. So I think since the team is working on this, I'd request one of the panelists. Ishaq Saab, are you there? And I think we have our umpire, Professor Tariq Wasim Saab. He's there with us.
Yes.
Right.
Sir, can you hear me?
Yes, we can hear you, and I think anything that you would like to suggest to the teams, regarding the spirit of the game and the process of learning, because that's what it's all about. And I think you can, we'd like to hear from you on that.
I think so far, both the team have performed very well. It's basically case-based or scenario-based questions, and if you have diagnosed it right, the rest of the things are easier. So since both the cases were there was a clear-cut diagnosis, I think there would be. You can say it's a very flat pitch now. They can probably hit sixes all around, all over. Process basically, I mean, it gives an opportunity to revise the cases, both who are participating and even the spectators if they are watching it. So this is a good opportunity to have a medical, I mean, just a revision. And that's how we, since this is a practice for their FCPS Part 2 examinations, usually you have scenarios like this, and that's a good opportunity. And I think they have all prepared it very well.
Thank you very much, sir, for the input. And we are back live. So the technical issue has been sorted out. The question is on the screen. And we are now going to move to question number 7. All right. Can we have it on the screen, please?
Hello?
Hello? Yes, sir.
Sir, can you hear me?
Yes, sir, I can hear you. Definitely, now I can hear you. Can you hear me, Ishaq Saab? Okay, so again, I think we have lost the screen. Ishaq Saab, can you hear us?
Okay. I lost the screen, but can you hear me?
Sir, there is a technical issue going on. The team is on it. I think you're also having internet issues over there. So with this, we now move to question number 7 now. Please read the question.
Question 7. What is the mode of inheritance of hereditary cases of this disease? Autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive, mitochondrial.
And timer starts now. 60 seconds.
हीमोक्रोमेटोसिस के बारे में पूछ रहे
ये
हैं.
हीमोक्रोमेटोसिस का पूछ रहे हैं या बीटा थैलेसीमिया का?
What is the mode of inheritance and hereditary cases of this disease? Hereditary hemochromatosis ना?
इस बात करें ना.
Hereditary autonomic या X-linked.
They are under pressure now because they have to correctly answer all the remaining questions to win it.
Hemochromatosis, hereditary.
Strikers,
Hereditary.
play it smartly.
ये hereditary primary होंगे ना?
Hereditary hemochromatosis primary है, वो X-linked है या autosomal है?
Autosomal dominant है, I guess.
20 seconds remaining.
Hereditary hemochromatosis. Hereditary hemochromatosis.
Autosomal recessive. Autosomal recessive better लग रहा है, हाँ.
Okay, autosomal recessive करते हैं.
10 seconds. Come on.
B autosomal recessive.
Are you sure about it?
Yes.
You want me to lock B, beta, autosomal recessive?
Yes. B autosomal recessive.
Okay, lock B, beta. And yes, this was an important question for you. Yes, it was a spinning delivery, but you have negotiated it very well. It's gone for a big 6. That keeps you in the game, in the hunt for victory. Well done, very well played. You discussed it well, and I think it's working well for you. Good. Last 3 questions. You have to get all of them rightly answered. If you get them correctly answered, it's your game to take. If you miss one, we have a draw. All right. Question number 8 on your screen.
Question 8. What is the most common gene mutation in inheritance cause of this disease? ATP7B gene mutation, HBB gene mutation, SERPINA1 gene mutation, CFTR gene mutation, HFE gene mutation.
And the timer starts now.
It's EHFE gene mutation.
Oh my goodness, he's been quick onto it, pounced upon it, and he struck it. Again, he's going for the extra cover boundary. Are you sure about it? Are you sure about it?
Yes.
Because this time
HFE gene mutation.
I could see a bit of Virat Kohli in you. Let's see whether it's a 6 over cover or not. All right. Which one do you want me to lock? E epsilon. Lock it. And yes! He is Kohli from here on. Well done. Very well played. I think very exciting. Wonderfully done. Great job. So again, it's going to the wire. What a wonderful match we've got. So we are moving to question number 9. Second last question of this innings. Please read it.
Question 9. What is the most probable cause of knee joint pain in this patient? Rheumatic heart disease, hemophilia, osteoarthritis, still disease, chondrocalcinosis.
Timer starts now.
𝐸𝐸 chondrocalcinosis.
My goodness, it's a reverse paddle sweep this time. Are you sure about it?
Yes.
They want me to lock chondrocalcinosis. Ishaq Saab, are you there?
Yes, I am.
They are playing it very quickly, all of them. It's a T5 going on. They want me to lock it.
I hope they don't fall.
Let's see. So lock E epsilon. And yes! Well done. Very well done. Beautifully played. Both the teams have done so well. And with this, we are 48 apiece. Both the teams are now tied here. But we still have one more question to go. And that's going to be the decider, especially for Lumhs strikers. And this is a very important question for you. I think most important question of the day.
Play carefully. Please play carefully.
Very rightly said by Professor Ishaq. He wants you to be very careful. All right. And he wants to see a bit of maybe Sachin Tendulkar in you. Let's see. Question number 10. On your screen, please. Read it.
Which symptoms are improved after phlebotomy in this disease? Joint pain, diabetes, cardiac symptoms, skin pigmentation, liver cirrhosis.
60 seconds on your screen.
नहीं are improved after phlebotomy. Joint pain, cardiac.
Timer starts now, please. Start the timer.
दो रिवर्सिबल होते हैं, सही है, दो रिवर्सिबल होते हैं, बाकी सब रिवर्सिबल होते हैं, वो कौन से रिवर्सिबल होते हैं?
That's a reverse swing delivery coming into the pads.
प्रोसेस तो नहीं है, डायबिटिक भी नहीं है, जॉइंट पेन भी नहीं है, कार्डियक नहीं है,
जॉइंट पेन क्यों नहीं हो सकता?
जॉइंट पेन नहीं होता, नहीं ये एमआरसीपी की लाइन है कि खाली
दो चीजें हैं, स्किन पिगमेंटेशन हो सकती है, ठीक है,
नहीं वो तो हो गया ना, एक तो काला हो गया, बस हो गया।
कार्डियक सिम्टम्स,
कार्डियक बेटर है, कार्डियक बेटर है, ऐसे कार्डियक
सी करें,
कार्डियक सिम्टम्स या इरिवर्सिबल है, कार्डियक वैसे ये एमआरसीपी के सवाल है, इसमें ज़्यादा कॉन्सेप्ट है ही नहीं।
कार्डियक सिम्टम्स
मेरे ख्याल से कार्डियक सिम्टम है और न्यूरो सिम्टम्स हैं, ये दो।
So 10 seconds left almost. Hurry up. You have to answer.
Cardiac symptoms. Cardiac symptoms.
C. Cardiac symptoms. You want me to lock C. Cardiac symptoms, right?
Yeah. Yes.
Okay. So we have now come to a halt. And we are now waiting for the answer. It is C. Lock C. Charlie, please. Let's see. And yes! That's a brilliant answer. It came in. It was an inducker. And this has been smashed for a 6. This is a beautiful answer. Very well done. Very well played. Lumhs strikers, congratulations to you. And I think Hyderabad must be very excited. Very well done. Commiserations to Mayo Knights. But I think you also played very well. It's a wonderful game that we have witnessed today. And I think congratulations to both the teams and everyone in general. And what a game it was. Beautifully played. I think we have our faculty members, the mentors are there. It's an exciting moment for everyone. But I would like to take the comments from our panel members. We have our patron-in-chief, Professor Ishaq Saab. Your thoughts, sir?
Ji, assalamu alaikum.
Wa alaikum assalam.
Thank you very much for having me. Although there was a little bit interruption, but I managed to watch most of it sitting in a remote corner of Pakistan. I must say that both the teams played very well. and you can easily see that the standards are coming up very nicely, and the loser also has got a very good score, by the way. So I think both teams need to be congratulated for their effort. Obviously, one has to win and the other has to lose, but both are winners in the sense that both have played well and both uh, needs to be encouraged to do even better in future. Um, I'm grateful to you for your nice moderation and all the other faculty members for. I think this has been a great experience last year with our cardiac Super League, and now this cardiometabolic we have combined with our metabolic friends from PSIM. So I think the standard has gone really up, and I think if we keep on doing these kind of exercises, we are bound to improve the credentials of our candidates sitting for exams or practicing cardiology. I think cardiology is one of the most fascinating subject and ever-changing theories and practices and guidelines. So I think I'm really glad to see how good they're doing. I was examining at Lumhs about 2 weeks ago for MD exam, and I can say that Hyderabad, the boys are really excellent. They're very hardworking, and congratulations to their mentors and to their faculty members, Dr. Kashif, Dr. Mehman, and everybody who was involved in their training. So thank you very much, Hamza. Keep it on. We missed you last time, but then I'm glad that you have come back. So from me, Allah Hafiz.
Thank you very much, sir. So the pleasure is all mine, and I was missing the seat and all of you. This show, I think there's a lot to learn for all of us, and it's a learning experience for everyone. No matter where you come from, no matter what you do, it's learning on the go. And with this, we have to take the comments from our worthy umpire, Professor Tariq Wasim Saab. I think he's been quite patient. He's been guiding us all the way. Sir, your thoughts on this match?
Both teams played very well. Of course, as Isasab said, one has to win and one has to lose in this competitive match like this. The cases were rather straightforward. As I said, once you have diagnosed it, rest of it is all more of a theory, and there are few technical questions in the form of genetics or that, which probably were very well picked up by the Hyderabad team. So congratulations to Hyderabad for winning, and Mayo, you played very well. So this is not that your team was weaker in any sense. So inshallah, there will be more opportunity like this coming your way, and of course we must appreciate Wilson's contribution to both training, education, and all that. And this I enjoyed it, umpiring it, selecting the cases, and then of course watching the match live.
Thank you very much, sir. It was great to have you on the show. I think it's a combined effort by everyone, and the credit goes to Wilson's Pharmaceutical for putting up this show. And I think this is a game changer in terms of learning for everyone, learning all around. So do we have the two teams still there? Are they there? Okay. So Lumhs Strikers, Hyderabad. Great to have you. I think since Mayo Knights they're not there anymore, I would have taken their comments as well. But your thoughts, final thoughts on the game. Quick comments, please. Please unmute yourself. We can't hear you. We can't hear you. Please switch the mic on. Okay, now I can hear you.
It was a very tough competition. The other team was very good. They had just two answers were had wrong, and we had one answer wrong. Though,
You just
we were afraid when they were giving the giving the answer. We were very afraid that what will happen to us. But when we started giving the right answers, getting more and more confident, more and more confident.
Yes, you know what? You just had the option of losing one delivery, one question. You lost one, but then you kept going. And I think from being 𝐩𝐫𝐞𝐬𝐿, you became a Kohli and then a Tendulkar. So I think you played it very well. You became more vigilant. And congratulations to the whole team. Very well done and best of luck for the rest of the games.
Thank you.
So with this, we now come to the end. It was great to be back, and what a match did we have today. We witnessed something which went to the wire. Both the teams were fantastic. They competed right till the last delivery, last ball, and I think it was the last question which decided the game for us. And it's, congratulations to both the teams, and it's victory all around. With this, the first game of this year, 2025, has come to an end of this Cardio Metabolic Premier League. It's great to be a part of this journey, and we all thank Wilson's Pharmaceutical, Pakistan Hypertension League, and Pakistan Society of Internal Medicine for putting this up and witnessing what we all are. And this is a journey for all of us, hoping that it's going to be bringing us more good memories, more tough matches for us in the coming days. And now it's time for us to say goodbye. I'm going to say goodbye to all of you. Allah Hafiz. See you till next time.